We'll continue our discussion of antimicrobials by now looking at antifungal drugs. Infections with fungi are called mycoses. They can be superficial, cutaneous, or a deep mycosis caused by many microorganisms that are saprophytic. They are plant-like, but they can't make their own food like plants. They need to parasitize and obtain their food from their host. The infections are mild and superficial to quite severe and life-threatening. The organisms can become ingested, they implant under the skin after an injury, or they may be inhaled if they produce fungal spores which are airborne. The antifungals that are used, the azole class of chemicals, examples ketoconazole, fluconazole, so once again a consistency in the way the generic names are used, all ending in that azole to indicate the chemical class. The azoles are fungistatic because they affect a particular component in the particular lipid membrane of a fungus that is unique to fungi, and this is the ergosterol. They interfere with a particular CYP450 enzyme system in fungi, once again very, very unique, that catalyzes the ergosterol formation. Because the ergosterol is not present in the membrane, it is not as structurally sound, and there is leakage of contents, inhibition of the fungal cell growth, and eventually death, but seen to be fungistatic, giving the organism's own host mechanisms time to then target that antifungal. Other azole antifungals used to treat cryptococcal meningitis, such as fluconazole, used to treat candidiasis, ketoconazole, clotrimazole, and others. The azoles used to treat tinea infections. The azoles will interact with other drugs because they inhibit a particular isoform in humans. This will increase the levels of those other drugs. So H2 antagonists, proton pump inhibitors, antacids will reduce the absorption and reduce the antifungal effect of the azole antifungals, and these azole antifungals will also interact with warfarin, causing an increased risk of a bleed. Adverse effects, gastrointestinal once again, flushing of the skin, hypersensitivity, some CNS effects, photophobia, and because they affect the CYP450 isoforms which are involved with normal metabolism of hormones, there might be menstrual abnormalities, gynecomastia, impotence, and this is due to inhibition of adrenal steroids and testosterone synthesis. This tends to happen more often with ketoconazole. So warnings and contraindications: avoid use in people with achlorhydria or hypochlorhydria. This will reduce drug absorption. They need an acidic environment. Azoles will interfere with alcohol, so tend to be used with caution or contraindicated in alcoholics or people with liver and kidney function impairment. Then to have a look at another one, caspofungin. This inhibits the synthesis of a particular beta-glycan, a polymer that's used in the fungal cell membrane. Caspofungin is indicated for serious fungal infections such as an invasive thrush and aspergillosis. Aspergillosis is commonly a lung infection. The people breathe in the spores of Aspergillus fumigatus, but there are many Aspergillus species in the environment. Mostly people don't develop the Aspergillus infection. They remove those spores by their normal body processes. But for some people, particularly the elderly, it sets up this aspergillosis, a fungal ball in the lungs. And so a systemic agent is needed and the caspofungin agent has certain serious adverse reactions. Of course, the usual gastrointestinal type adverse effects, the usual ones associated with a hypersensitivity, but also fever, flushing and chills, and caspofungin has to be given by injection, and there may be then phlebitis at the site of the infection caused by that caspofungin. Flucytosine is one that interferes with a particular metabolite. It's an analogue, very chemically similar. Flucytosine is converted to fluorouracil, so by that name you begin to see which pathway it's going to interfere with. So flucytosine is an anti-metabolite, or the actual fluorouracil is the one that's doing the inhibition. So it interferes with pyrimidine metabolism, and it prevents nucleic acid and protein synthesis. Flucytosine is indicated in fungal endocarditis, meningitis, pneumonia, and septicemia, and urinary tract infections. They tend not to be caused by fungi, but the two that can cause the infection, Candida or Cryptococcus. And Cryptococcus and Candida also the causative agent in those other quite serious systemic infections. Adverse effects of flucytosine, once again CNS effects, gastrointestinal effects, but also anemia, hepatitis, and suppression of the bone marrow. Griseofulvin is a fungostatic agent. It interferes with the fungus during mitosis, particularly at metaphase. Once again, because we also are eukaryotic, this chemical could cause quite adverse effects in humans, but griseofulvin is used topically to prevent those adverse effects. So it's used for tinea of the head, skin, nails, groin and feet that's been unresponsive to ketoconazole or clotrimazole or one of the other agents. Adverse effects of griseofulvin, once again CNS effects, gastrointestinal effects, but an actual gastric distress is caused if it is absorbed systemically, a photosensitivity and leukopenia. Amphotericin B is another one of those antifungals that targets that unique chemical, ergosterol. It physically binds to ergosterol rather than interfering with its biosynthesis. But because, once again, it's not present in the membrane is weaker, it's more permeable. The fungal cell will lose potassium and other cellular contents, and as you can guess, this type of mechanism tends to be microbicidal, so amphotericin is described as being fungicidal. It kills the fungal cells. You'll see that it's indicated once again for very serious systemic mycoses, aspergillosis, blastomycosis, candidiasis, and fungal meningitis or endocarditis. So once again, that Cryptococcus microorganism might be involved. It is given intravenously. It is given in hospital to monitor for this particular effect, renal toxicity, which, as you can see, occurs with a very high frequency. Also, the hypokalemia has to be monitored, so the person is given the amphotericin in hospital. In a quarter of cases, hypokalemia will result. In addition, amphotericin produces gastrointestinal distress and CNS effects, but also cardiac dysrhythmias, another reason for it being given in hospital and monitored, and potassium levels in the blood being monitored. So in summary, the sites of action of antifungal drugs. There are those that target the fungal cell membrane, that unique chemical ergosterol. They might interfere with the biosynthesis of ergosterol, or like amphotericin, bind to it. Then the beta-glycans in the fungal cell wall becoming another unique target, not present in Humans, we don't even have a cell wall, so less risk of adverse effects. Then there are those that target the nucleus, that inhibit nucleic acid and protein synthesis. This was flucytosine. It is converted to an anti-metabolite, fluorouracil. Griseofulvin, which inhibited fungal mitosis, had the risk of also doing the same effect to a human at metaphase in mitosis in their own cells, so griseofulvin given topically. Caspofungin inhibited the synthesis of the glucan in the fungal cell wall. The azole antifungals inhibited the ergosterol synthesis. Amphotericin B, the one that bound to the ergosterol, and another antifungal, nystatin, also binding to ergosterol, leading to alteration in cell membrane permeability, and nystatin, another one, an antifungal that is generally given topically only.